Okay, start.
Hi, this is Dr. Vinatha Puli. I'm the Clinical Director for Obstetrics and Gynecology at KIMS, Cuddles, Kondapur. Today, we are going to discuss about cord blood banking. It's a recently coming up topic that many couples want to know a little bit more of information so they can take a decision whether to save the cord blood or not. So let us look at what is cord blood banking. Umbilical cord is the one that is a connection between mother and the baby. There is something called placenta that forms between the uterus and the baby. The blood doesn't go directly to the baby from mother to baby. Instead, the transfer of all the nutrients and materials will happen in what is called that placenta, and that transferred nutrients will go in the form of blood to the baby. So this is what is called as cord. But that cord has blood that flows to the baby, has special properties. There are some stem cells, what we call, that has a potential to develop into any form of other cells in the body, if we can develop. And that has led to what is the research has shown that we can use those stem cells in the cord blood for different types of ailments if we have to treat. So is it really useful? Is when we see a couple and they talk about their option of should we store the cord blood or not. This is what will go on in everyone's mind. Whether is it going to be useful for me? Am I overdoing it or am I not doing something that is really required? So we don't know whether we require that in future or not. So what is anticipated is the probability of us using the same blood for the same person, the cord blood that was taken, and the baby grows, and in the future, them using that cord blood will be 1 in 400 to 1 in to a couple of thousand people. So it's not very common that you end up using that blood. But why collect the cord blood if we are not sure whether we are going to use it or not? Its first successful transplantation of that blood, the cord blood, has happened in 1988. This is years ago. And now still the research is going on. There are few areas where the research is gone and we are using it in clinically, like in practice, that blood is being used. But there are still lots to come. There are most probable things that we are now at this moment of time correcting with cord blood are few inborn errors of metabolic problems of the baby, or some blood malignancies, blood cancers, hematological cancers as we say, and some genetic disorders of immune system and blood. These are the areas where research has gone and we have seen that this cord blood has been utilized. And now, if we have to collect the cord blood, what are the options available for us? Like we have public banks and we have private banks. In any country, these two options are available. So what does public bank mean? That means they collect the blood, but they store the blood, but use it for whoever they need it. Like imagine a blood bank that collects the blood, but they can use it for some other person when they need it. Private banks can also offer this, but at the moment, most of the private banks are offering storing blood, collecting blood, everything, but to use it for themselves. Like, you are paying money and for you to use for yourself in future. So that is the difference between public bank and private bank. So money is involved. And what I need to know if this is the question that goes on? So there are few slides that I'll take you through that what information that we must know before we decide whether I want to save the cord blood or not. The cord blood collected from the baby is used to treat a genetic disease or cancer. But if they have some genetic disorder or metabolic problem, using the same cord blood will not help the baby. So that is something that we have to understand, that in case we collect the cord blood, because there are in family, there are some errors of metabolism, and that baby later develops some metabolic disorder, the cord blood also will have the very similar cells. So there is no point in using the same cord blood to correct that problem. So that is the main thing that people have to understand. If in case you think that it is being utilized for every problem on earth, it might not be the same. So I think that is the reason why public banks are going to be helpful. Or check with your private bank if they can provide that service of other people also, because you cannot utilize your own cord blood. So have some other donated blood to be utilized for your problem of metabolism. So that is something that we must understand, that it is not answer for every disorder on earth. And you have to also be aware of the quality control and regulatory organizations that will provide that umbilical collection and storage. So who will take the responsibility? There are so many public banks and so many private banks that are coming. If you ask us, if you ask me, I have not seen, all the collection procedures and storage procedures for all private banks. So we are also unable to, guide you that this is the best private bank that I have seen, because I've not seen all. So at the same time, when you are deciding, try to ensure that, how is their collection, how is their storage, and what are, the provisions that they are giving. So this is something that you have to ask your provider before you take that decision. And you also have to know that, sometimes when the baby is born, we very well understand these days that first 1-2 minutes, the baby will still get the blood flow from the placenta through that cord. By delaying that, cutting the cord for that 1-2 minutes, baby is going to have a lot of advantage. Baby is unlikely to develop anemia, and so there is a lot of advantage why we allow that blood to flow to baby. So when we are collecting cord blood, we should not be in a rush that we first, collect the cord blood. We first have to make sure that we will not compromise the obstetric care. Sometimes if the baby is distressed, we might not allow that cord blood. We might want to resuscitate the baby very quickly. But at the same time, when baby is doing well, we want baby to get the full best, cord blood that flows to the baby. So baby should get that first advantage. And only then the collection or something starts. So during the process of collection, we want more blood to be there for the storage. So we have to not make the decision of, because blood will not come for storage, that is enough, you should not clamp the cord quickly. So no obstetric or neonatal compromise should happen because you have chosen to collect the cord blood. So there are some situations where the obstetrician feels, no, we might not have time for the collection of cord blood, because if you are bleeding very heavily, we don't have time for collection and everything, then we will take that decision that, that is not the priority. Mother's life is the priority. So we'll carry on with this. So just taking the decision of cord blood collection sometimes vary with these decisions on table. So the current indications of cord blood transplantation are limited to very selected genetic, blood cancer related, hematological, and some cancer related disorders only. There are so many people who will tell about a big list of potential uses, but at this moment of time, these are the indications. And private banking may be considered when there is a knowledge of the family member. Already, if there is someone in the family with a medical condition, with a known genetic disorder, with a known blood cancers or something who could potentially benefit from the cord blood, then yes, there is advantage of going in for cord blood collection. And all families of different ethnicities and races should consider this society benefit and consider public banking. Or even if you are affordable, you can take the private. Make sure that, they can be utilized for others. If it is not useful for you, someone else get that benefit. Okay, that will increase the availability of cord blood. So availability of resources and use to other people also. And the care providers, the obstetricians, who are the main persons who are behind at the time of, because most of the patients also ask us, like, like before they take that decision of whether should we collect the blood or should we not, is it essential? They should not go away with the feeling that, I have not done something for the baby. They should also not get the feeling that I've never been told about this option. So at the moment of time, discussing we are discussing that the option is available, but you have to understand that it's not the essential thing. Some people will go on telling that, it's like a insurance for the baby, and don't feel that, you have not taken something, you are compromising the care for your baby. It's not like that. So we also have to know about some laws regarding the cord blood banking, including the laws in that particular states that requires physician to inform. So it is our duty also to tell our patients what are the rules, what are the regulations, what are the options. That's all. And then you can take a call. And some financial interest. This is something that, there is so much of conflict of interest when we tell about the cord blood banking. We have to be transparent in telling that if we talk about private cord blood banking, then please disclose the interests. That's like any other, like, if you write and if you do a research and someone is giving you a grant, you have to declare that, that interest might be there, that can be the conflict of interest. That's what we say. So at the same moment, I think we have to discuss that if we are suggesting one particular private cord blood banking, then please disclose what is the conflict of interest, so that it goes clear, so it is transparent. Some might have the associations, but some will say we are not related, you choose whatever, because the information is all there. Our duty is to only provide the information and option. But which blood bank to go and all these things, it's usually left to the patients. So, and it is also our responsibility to tell if at all we are suggesting any one particular brand or private bank, then if you have any interest, let's be transparent. It might be some financial grants that they are providing to the hospital or whatever, but let them know that. And so we are quite transparent about it. If patient requests information, then the information that we are going to provide should also be a balanced one and accurate one for the time. And advantages, disadvantages, everything we have to tell. And the options, public banks and private banks, both we have to discuss and then leave it to the patient to decide. There are variety of circumstances that might arise during that process of labor and delivery. This is what I was been talking about, that can change our decision, or that can limit the collection, like adequacy of collection. So for example, if we have to give that 1-2 minutes cord blood, allow the cord blood to flow to the baby, and after that we clamp the cord, then we have to start collecting. Sometimes by then placenta is getting separated, we might not have adequate blood collection process, but we have given the maximum advantage to the baby. So this information has to go in straight to the parents. Don't think that the moment we decide on a cord blood banking that it is going to happen 100%. If it is in the interest of the baby, you might have some compromise, but we will never compromise the baby or mother for collection of cord blood. Very, very rarely, when there is very exceptional medical indications that cord blood collection is the most essential one, yes, then we can do that as the first priority. But almost 99.9% of the time, our priority will not be so medically indicated. It is only optional indications. And umbilical cord blood banks are permitted only under license and monitoring by, in India, this is in India, Central Drug Standard Control Organization. The cord blood banks have to comply with the Drugs and Cosmetics Act and rules. And if you want to know whether your private bank is okay or not, you can go into the list of all licensed banks, and the list is provided in their website. So go to CDSCO website and see whether your private bank is listed in that, and then you know whether they are complying with those regulations or not, at least if they are in that list. So you will not get misled by some odd organizations which are misleading you for other things. So registered organization, registered private blood banks, if they are in that website, they are licensed, then go with those. Hopefully that will answer some of the queries about the cord blood banking. So there will be so many other queries that might come up. So we will wait for any of you to have questions so we can take that questions and answer. But if you still need further information, you have good long 9 months to decide about the option. So whenever you think, no, go and talk to your healthcare provider. There is information online so much, but there might be queries like this, that you going to have this medical problem that will hamper the collection of cord blood, or are you going to have that anyone in your family has so much of a medical problem that you really want to store the cord blood. Then discuss with your doctor, and then they'll prioritize, okay, your cord blood collection is so important that we will definitely do it. Or is it really like, just because it's an option provided by everyone, are you taking the decision? Then that's fine. But don't go away with a guilty feeling that I have not taken something because I cannot afford. It is perfectly fine at this moment. Limited number of people are utilizing it, and we hope that more public banks or shared private banks, that you can share that blood to others, will bring in the same equality and hopefully utilization of all the stem cells. Thank you very much for the session, and I'll still wait few minutes for questions. Thank you.